Prevention about dementia. Can dementia be prevented? Here I want to be careful and honest. There is no guaranteed way to prevent all dementia. But many experts agree that addressing modifiable risk factors may reduce or delay onset of dementia in some people. WHO and major organizations emphasize brain healthy lifestyle such as controlling blood pressure, treating diabetes, managing cholesterol, staying physically and mentally active, avoiding smoking and avoiding harmful alcohol use, maintaining a healthy weight, eating healthy diet and treating depression, staying socially engaged, addressing hearing loss and protecting sleep. Practical dementia prevention strategy. Let me put this in a very simple language. Protect your blood vessel because blood vessels supply tiny portions of every tissues, and you need to protect the tiniest part of your brain. Okay, so you gotta protect your blood vessel. What is good for the heart is often good for the brain. That means keeping blood pressure under control, treat diabetes well, improve triglyceride and cholesterol, walk regularly, and no smoking. Exercise consistently, regular physical activity, daily walking is half an hour is great, and twice a week strength training. That's what you need. 30 minutes of walking. Now, 10 minutes walk after every meal. That's the best way to do it. That gives you 30 minutes. And then choose 2 days for a strength training. Exercising consistently would help you and help support better blood flow, mood, sleep, and insulin sensitivity and brain health. So even moderate regular activity is better than being sedentary. Sleep matters. Poor sleep and untreated sleep apnea can worsen cognition and daily function. Sleep is when the brain restores and consolidates memory and clears waste products. Treat hearing loss. Hearing loss is often overlooked. When hearing drops, the brain works harder to decode sound, social isolation, and then social isolation increases and cognitive strain may rise. Stay mentally and socially active. That helps you to read, learn, converse, teach, volunteer, play some board games, strategy games with your friends, joining groups and staying involved keeps your neuronal connection intact and helps you create a new neuronal connection. Manage depression and chronic stress, avoid repeated head injury, like use seat belts, helmets, fall prevention. So, brain protection starts in midlife, not just in old age. By 50, you need to be very proactive about your health, and that includes taking care of your heart health and brain health, physical health. So, if you start doing the right thing, everything will come in place. How we evaluate suspected dementia. Now let's talk about one of the most important thing, which is a workup. So if the patient family says, my dad keeps repeating himself, or my mom is forgetting medication, he's getting lost, she's acting very differently, something is not right. So then we have to do systemic evaluation. First of all, we ask, when did the symptoms start? What were the onset, sudden, gradual? Is it worsening slowly or in steps? Is memory the main issue, or behavior, or language problem, or hallucinations, walking, or judgment? Is patient managing pills, medication, driving, finances, cooking, any falls, strokes, tremors, depression, sleep problem, alcohol use, etc. Those are very important questions. And very importantly, one of the family member or caretaker will give you detailed information. Then we do cognitive testing. We do MMSE, but there are several others. One is called mini cog and the other one is called MOCA. These tests do not diagnose the cause of them by themselves, but they help show which cognitive domains are affected and how severe is impairment. Then there is a neuropsychological testing that could be more useful when picture is subtle and atypical and in early cases. Functional assessment, we assess a person can handle finances, medication, shopping, driving, appointments, technology, bathing, dressing, meal preparation. So this helps distinguish mild cognitive impairment from dementia. Um, Many times family members, we have to write a letter about their capacity, mental capacity. Recently I had a patient who has really not taken care of himself, and he gets lost and he drinks in the night time, and he thinks that every medication is a poison for him, so he's going through all these changes. So you have to, I have to write a mental capacity letter. The son can help him. Review of medication and substances. Some of the medication can affect and mimic like patient is having dementia. Lots of anticholinergic medication, sedatives and pain medication. They can be very bad for elderly people. Sleep medication, alcohol, and polypharmacy in general. Lots of medication have effects, and which can create a confusing picture. And lots of folks are on SSRIs and other antipsychotic medication, so that creates a different kind of issues and can create a confusing picture. Physical and neurological examination, what you look for is like a tremors, rigidity, abnormal gait, focal weakness, any vision problem, signs of Parkinsonism or frontal release signs. This clue can point towards vascular type or Lewy body type or Parkinson dementia. If somebody has tremors or rigidity, that may point towards Parkinson issue-related dementia. Somebody has, suppose, abnormal gait, but depending on short and shuffling gait could indicate Parkinson type. But Lewy body can also have a gait issue and Parkinson-like feature. Then, of course, you have people at the frontotemporal, they have personality changes and they become impulsive, and they start lacking sympathy. So those changes can indicate towards frontotemporal dementia. Blood test, CBC, comprehensive metabolic panel, thyroid, B12, folic acid, those are very, very important. But now we have a new test, it's called p-tau 217 phosphorylated test for Alzheimer's. But they are general workup we do. And then next one is MRI. They're very helpful. Even CT scan, if MRI is not available, it can tell you, identify stroke, brain atrophy patterns, tumors, subdural hematoma, hydrocephalus, etc. Biomarker, amyloid PET scan and CSF testing and blood-based biomarkers, those are important, and that can help differentiate dementia because you want to treat reversible contributors. You want to treat the specific dementia when possible and support function and safety and reduce complication. Sometimes B12 deficiency can help, and thyroid disease treatment can help as well. Treating depression, improving sleep, optimizing hearing and vision would be also very, very helpful. Some symptomatic medications are there which help symptoms: donepezil, rivastigmine, galantamine, and memantine. Those are medicated. They don't cure, but they help symptoms. They delay the memory loss. So that's my video, second one. I'm gonna do the third one as well for some detailed information. So watch for that. Thank you for watching.